Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss evaluation and management practice questions based on MDM, which is medical decision making. If you want to learn medical decision making, all the elements I've already explained, I will add that video link in my description. Please go back and check that video for your better basic understanding on medical decision making. So in this video, I'm just giving you an overview and we will discuss the practice question for better understanding. So yes, let's start. So guidelines for selecting level of service based on medical decision making. So as you know, if we are talking about outpatient ENM coding, here we follow two methods. One is taking a ENM code based on MDM and one more is time based. Okay, these are the two methods that we follow. But apart from this, we do have to know few other things. So first, let's purely discuss based on MDM in this video. So four types of MDMs are recognized: straightforward MDM, low MDM, moderate MDM, and high MDM. Okay, so whatever the MDM we will get, based on that respective ENM code, whether it is new patient or established patient, we will check and we will assign the code. Okay, and this MDM concept does not apply to 99211 and 99281. 99211 is an ENM outpatient established visit. 99281 is an emergency department visit. Both are for a nurse visit, not for a provider. So MDM is purely for provider coding. So next, what and all you should know. MDM is defined by three elements. The elements are, okay, to take this final MDM, to lead that overall MDM is a straightforward or low or moderate, we should go and check all of these three elements. Okay, so the three elements are, the first chart is the number of complexity of the problem that are addressed during the encounter. So that is called chart A. In simple words, what is the problem being identified by the provider in the current encounter? Okay, that is called problem addressed. So next, the amount and complexity of data to be reviewed and analyzed. So in order to treat that problem which is being identified or the problem that patient is expressing, in order to find that, like what exact reason, we will follow few procedures. The provider will follow or perform few procedure that will be categorized in the chart B. Okay, in simple word, data points. And at last, a risk of complication, which is nothing but a patient management, that is treatment plan. Okay, in order to treat the patient condition, what are the treatment plan that provider is serving? Okay, so we have to check all of these three elements to get the final MDM level. Okay, so let's just discuss all of the three MDM elements. As I said, I have already explained. Please go back and check my videos. Okay, the link will be in description. So followed by that link, you can get that video. So let's quickly review chart A, chart B, and chart C as well. So yes, before going to that chart A, B, and C, you should also know MDM calculation guide. So here what, in this MDM calculation guide, we will follow two methods. The first method is must consider two of three MDM elements for overall MDM level. So as you all know, we have three MDM elements, that is chart A, chart B, and chart C. In these three charts, we have to consider any of the two charts. Use any charts that are meet or exceed. So if any two charts are meeting same MDM level, then we will take that. And we are going to drop the lowest one. Okay, this is one method in calculating MDM. So you can see the example here. Type of service is office or outpatient. Type of visit is a new patient. Number of complexity and the problem addressed. So the chart A is giving you a moderate MDM. And amount and complexity of data to be reviewed is also a moderate. and risk of complication, morbidity and mortality of patient is low. And so we are meeting according to our guideline. Use any two charts that are meet. So we are meeting two charts as moderate. So our overall MDM, final MDM is moderate complexity. Okay, since the patient is new patient, moderate MDM level will be 99204. Okay, this is the one MDM calculation, like one method, and we have one more method. So the next guideline we have is, if all three MDM elements are different, then follow the MDM hierarchy and choose the mid level. Mid level is nothing but an average level. Okay, so here type of service outpatient and type of visit is new patient. Problem is low and data is moderate, risk is high. Okay, so all three MDM elements are different. So in this case, the guidelines suggest us to take the average level. So if you see the hierarchy, it is after low we have a moderate and high. Okay, so now in this case, between low and high, we have a moderate level. Okay, so this will be our average ENM level. So we are going to take our final MDM as moderate complexity. In case if you are getting problem as straightforward, data as low, risk as moderate, so you are going to take the middle one, which is low. Okay, because in between straightforward and moderate, we are getting low level. So we have to just go by an average. It is not like the level which presents in middle. Instead, you have to understand we have to take an average level. It should not be too less or it should not be too high. In middle, we have to give the justification. Okay, so that is the second MDM calculation guide. So what we will do, we will see a few example based on MDM calculation guide 1, and we will see few example based on this particular guideline. Okay, which is if all three MDM elements are different, what we have to follow. Okay, so let's see few examples, and again for the better understanding, you just have to go what is there in problem chart A and chart B and chart C. So I have added in the next slides. So as I said before heading to practice question, we will just see what is there in chart A, chart B and chart C. So firstly chart A, which is for problem being addressed in the encounter or problem being identified by the provider. Okay, so in this chart A we will find straightforward level, low level, moderate level and high level. Okay, so once we notice what is the problem or problem being addressed, we have to check that particular problem exists in which level. Okay, say for example, patient is having uncomplicated illness. So it will be there in the low level. And if your problem is a chronic illness with exacerbation, then it will be in a moderate level. Your problem PDR, the T belongs to moderate level. Okay, so now say for example a patient is having a head injury which is a complicated injury, so it goes to acute complicated injury. It is moderate level. So all of these terms I have already explained. Okay, please go back and check as I said earlier. And then this is regarding our chart A. It is purely based on what kind of problem being identified, and we just have to check what will be our problem addressed level. Say for example, we will consider our problem as low level. Okay, so let's move to chart B. So in the chart B, we have data to be reviewed and analyzed. So here also we have 4 level, minimal level, limited, moderate and extensive. So based on what provider is performing test and document or independent historian or independent interpretation or discussion of management. Okay, so we have to check like collecting all the data and we have to lead what will be our final data level. Okay, so that will be there in chart B. Next we have chart C. Chart C is for risk of complications or morbidity or mortality of patient management. Nothing but it's a treatment plan in order to treat the medical condition. Okay, say for example, provider is giving you only general instruction, then your risk will be minimal. And if provider is performing or prescribing OTC drug, then it will be low. If provider is giving you a prescription drug RX, then it will be moderate. Okay, if any kind of severe treatment plans, if patient condition is emergency and ordering any kind of major surgeries with identified risk factor, it will be high. Okay, so you have to check again from risk chart C what will be your level. So by taking all of the MDM level, we will able to lead the final MDM level. Okay, so let's start to see practice question. Let's apply all of this and we'll easily able to start relate to it. So these are the codes for office visit and outpatient codes. So we have to check patient is new patient or established patient. So for new office or outpatient code starts from 99202 which is for straightforward MDM, 99203 which is for low MDM, 99204 which is for moderate MDM, 99205 high MDM, and 99212 is for straightforward, 99213 is for low MDM, 214 is a moderate, 215 is an high. Okay, this is for established patient, this is for new patient. So these are the code set we have for ENM OP, outpatient or office visits. Okay, so let's see a few practice questions based on MDM coding guideline, that is use any two charts that meet or exceed, drop the lowest one. So the first question we have is 25-year-old new patient present with an ankle pain after a fall. The provider orders an X-ray and advise over the counter pain relief. So what will be the ENM code? So here, whenever we are dealing with the ENM outpatient codes, as we know, to lead the final MDM, we need this charts, three charts, that is PDR. What is the problem level? What is the data level? What is the risk level? So based on this, we will get the overall MDM. Okay, so here what is the problem? The problem is acute ankle pain. So you should know where this acute ankle pain, in which problem level you will get the acute ankle pain. So I can say this will be in the acute uncomplicated injury. Okay, same way the provider orders an X-ray. So X-ray will be your data point and advises over the counter pain relief. So OTC drug, it will be your risk. So we know we are getting all these three charts here. So let's conclude a final MDM. Okay, let's see the rationale for this question. So here, as you can see, the rationale for this particular question we discussed is the problem addressed, acute uncomplicated injury, which is ankle sprain. So acute uncomplicated injury is listed in the low problem level. And then data reviewed and analyzed, that is chart B, X-ray ordered. So only one X-ray, only one point we are getting, so it will be in the minimal data. Okay, so minimal data. And risk over the counter medication, we will get a low level. Okay, so we got all the three MDM elements. Now let's apply the coding guideline and we'll lead the final MDM level. So our coding guideline says must take the two elements which are meeting. So in this case, low, that is problem addressed, and risk, both are meeting low level. Okay, so let's conclude our final MDM level as low. Okay, so we have to drop the minimal level because it is the lowest one. So we are meeting low level as a problem, low level as a risk. So totally we will get final MDM as low. Okay, so the rationale you can see two elements, problem addressed and risk meeting low. So we have to go by low complexity of final MDM. So our answer will be 99203. So for the previous question, answer must be 99203. Okay, I hope you got it. So let's move to one more questions. So next question, an established patient with a poorly controlled hypertension and headache. The provider discussed lifestyle modification, orders renal function panel and prescribe new antihypertensive medication. What is the NM code? So again, apply the PDR. The PDR, the problem is poorly controlled hypertension and headache, and provider discuss lifestyle modification, orders a renal function panel which is going for data, and then finally our risk is treatment plan is antihypertensive medication. Okay, so we got a problem, we got a data point, we got a risk. So let's see what will be our overall MDM with the rational. So options you can see 99212, 213, 214 and 215 since patient is established patient. So coming to rational, here problem addressed, they documented poorly controlled hypertension, so which will be documented in moderate problem level because it is a chronic illness and with exacerbation. Why it is getting exacerbated? Because patient is also having headache. Okay, that is a sign that his hypertension is getting exacerbated. So hypertension, we know that is a chronic illness, and here since they documented headache, chronic illness with exacerbation. So this particular coding point will be there in the moderate problem. Okay, so our P problem addressed is moderate. Next, data reviewed and analyzed. Ordering renal function test. So it's a panel and only single panel being ordered. So we will get a minimal data complexity. Okay. And last, risk, that is moderate because they have prescribed a new prescription drug. Okay, they have ordered new that particular drug for hypertension they have ordered, so that will go to moderate. Okay, so now if you apply the coding guideline, must take two elements which are meeting or exceeding. So here if you see this again, P and R, problem addressed and risk, we are getting moderate level, so our final MDM will be moderate. Okay, so final MDM level as moderate, patient is established, so final MDM as moderate, established patient code is 99214. Okay, 99214 will be the answer for second practice question. So next we will see few more examples. So here a 13-year-old new patient present with a persistent cough, wheezing and fever for 3 weeks due to difficulty providing a complete history himself. Father gave the history behalf of the patient. The provider performs a comprehensive history exam and orders chest x-ray and sputum culture, confirmed bacterial bronchitis and prescribe antibiotics. Okay, so here if you see the question, understand what is the problem and understand the data level and risk. So easily we will get the final MDM level. So option you can see, option A is level 2, option B is level 3 and C is level 4, D is level 5. So firstly we'll identify what is our problem. So here you should know the difference between problem and problem being addressed. So we should not always go by problem. Problem is something that patient is expressing, right? After performing the labs or after performing the X-ray, what did the provider identified? Okay, so that is important. That is called final DX. So our while taking a problem level, we should always see the final diagnosis. So here patient present with a persistent cough, wheezing and fever. Okay, these are the symptoms that patient is already having. So after that, if you see due to difficulty providing complete history himself, father gave the history. So here you should know that the father will be considered as independent historian. Independent historian is nothing but the one who gives history other than patient. Okay, so father will be considered as independent historian here, and it will credit to data point. And after that, provider performs comprehensive history and exam, orders chest x-ray, you are getting 1 point here. And sputum culture, this is again a lab, 1 point. So finally he confirmed it as a bacterial bronchitis. Okay, bacterial bronchitis, and prescribe antibiotics. So prescribed antibiotics. So risk is Rx management is there. So problem, if you see the problem here, bacterial bronchitis, okay, which is acute illness, and with this we have some symptoms which are severe. Okay, systemic, you can say systemic. Wheezing is there, and fever also there, and cough is there. So overall if you see, it will credit to acute illness with systemic symptoms. So that particular point where we will get in problem, and other aspects we will see with the rational. So here is a rational. So as I said, the problem addressed was acute illness with systemic symptom. So bronchitis, which was bacterial bronchitis with a fever. This particular acute illness with systemic symptoms are documented in moderate level. Okay, so our problem is moderate. And data reviewed and analyzed. So provided ordered chest x-ray and sputum culture. And with this you should also know that father, okay, there were 1 point where father given history, so that will credit to independent historian. So we are getting 3 points, so we will meet the moderate complexity. Okay, so the data will be moderate complexity. And then risk, again risk is also prescription drug antibiotic is given, so that will also give moderate level. So if you look at it, all the three MDM elements are giving moderate level, so we are going with our final MDM as moderate. Okay, so the answer will be 99204. 99204 will be our final answer for the particular question. So next we will see one more example. An established patient present with a stable diabetes and hypertension. The provider reviews a recent HbA1c and lipid panel, reviewed the current medication and made a dosage change and advised a follow-up in 3 months. Okay, so now here if you look at it, patient is established and patient present with a stable diabetes and hypertension. You know both are chronic condition, but they are stable. Okay, so you should know stable diabetes and hypertension 2 plus chronic illness will be documented in moderate level. Okay, and then provide a review a recent HbA1c and lipid panel. So here the provider is reviewing the patient records, and also he reviewed the current medication and made dosage changes. So Rx management is there. He's not just saying current, like continue the current medication, instead he is making some changes. Okay, and advises follow up in 3 months. So here what are the points we will get? We'll see with the rational. Okay, you can see the option and you can pause, and also you can just try to solve on your own as well. Okay, I'm just giving answer little early, but you can pause and you can write your own rational, and later you can check the answer. Okay, so see the rational. As I said, problem addressed was two stable chronic illness, which will give you moderate level, and data reviewed, the provider was reviewed the medical record, he was reviewing the lab, so it will give you a minimal data. And then risk, here he made a medication changes, so it will give moderate. So we are meeting problem and risk as moderate. So overall MDM will be moderate level, and it supports 99214 for an established patient. So answer will be 99214. So I hope you are all getting a little idea about it. 70-year-old patient with a chronic heart failure comes in for a follow-up after a recent hospitalization. Provider evaluates medication adherence and also orders a blood work. Discuss adjusting the current diuretic dose. So problem is chronic heart failure and data provider is ordering blood work and also is adjusting the current diuretic dose, okay, which will credit to risk. So see the options and try to answer by yourself. Okay, so let's just see the rationale. So problem addressed is a chronic illness with exacerbation. Patient had a heart failure management post hospitalization. So we will get a moderate problem addressed level, and data is ordering blood work, which we will get minimal complexity. Risk prescription drug management with adjustments, so we will get a moderate complexity. Final MDM level will be moderate because we are meeting a problem addressed and risk as moderate. So here answer will be 99214. Okay, so most of the case, why I am taking 99214, most cases are just to make you familiar with the level 99214 or 99204, because it is widely recognized. Most of the problems will end up treating with the level 4. Okay, level 3 and level 4 are most common, so that is why I have just taken a scenario for level 3 and level 4, and we'll see few more. So here if you see, a new patient presents with a sore throat and fever, history taken from mother. The provider performs a rapid strep test, influenza test, and both are negative, and advises to take the over-the-counter drug and gargle with the warm water. So problem is sore throat, okay, and fever. So for that, mother has given the history and provider performs rapid test and influenza test. So two tests being performed and advises to take the over the counter drug. So just see the rationale. So here acute uncomplicated illness. So sore throat is like pharyngitis. Since it is a negative test, we will consider acute pharyngitis. So acute uncomplicated illness will give low problem level. Data review, two tests performed and analyzed, and with that one historian. Independent historian is mother. So in combination of test and a historian, we will get a moderate data level. And finally risk is OTC. So since provider given over the counter drug and given a general instruction, so we will get the low risk. So finally we will meet, our answer will be, we are meeting risk and problem addressed as low. So answer will be 99203. Okay, so new patient, answer is 99203. And next we will see. So up to here, whatever the practice question we have solved, those question was getting two charts were meeting. So we were taking MDM, final MDM as two charts which are meeting, and we were dropping the lowest one. But here, what if you get all the MDM elements are different? So in the earlier slide, I already explained the guideline. In this case, three MDM elements are different. We will follow the MDM hierarchy and we will take the average MDM level. Okay, so on that also we will see few example. So if you see this question, a new patient present with an abdominal pain and missed periods. The provider performs a pregnancy test which is positive, identified risk factor and schedules a minor procedure for suspected ectopic pregnancy. Okay, so patient is new, you can see the options. So what is the problem that patient is having? Problem is abdominal pain and missed period. And what provider is performing? He performed the pregnancy test. Okay, one unique test, and identified risk factor and schedules minor procedure. So this scheduling minor procedure with identified risk factor or without identified risk factor, any kind of scheduling minor or a major surgeries will be listed in a risk. Okay, so chart C. You will get this in chart C. So here we are having identified risk factor and schedules a minor procedure. That means minor procedure with identified patient or procedure risk factor. Okay. So that particular point where we will get in the risk table, we have to check in which level we will get. So problem, data, risk, and we'll see overall MDM. So let's see the rationale. So see the rationale here. Problem addressed was abdominal pain and missed period, which comes in acute uncomplicated illness. So our problem level is low. And data reviewed, data section only pregnancy test performed. So it will give you one single data point. So we are considering minimal data. And lastly, risk, decision for minor surgery with risk factor. So there were possible like suspected ectopic pregnancy was there. So that is why we are considering it as identified risk factor. So if since we have a risk factor, though it is a minor surgery, we will get risk as moderate. In case if decision for minor surgery without risk factor, that would have been in the low risk level. Okay, so that is the difference. So you can go back and check the risk table, or just whatever I have added in the earlier slide, that only you can check it. And now, as I said, if you apply that particular MDM guideline, as three elements are different. So if you see problem is low and data reviewed, that is minimal, and risk decision for minor surgery moderate, all the three MDM elements we are getting in a different level. So in this case, what we have to do, we have to take the average level. Okay, so to consider moderate MDM, it will be in highest level, and to consider minimal, that is straightforward, it will be a lowest level. In middle, we will get low. Okay, low will be our average MDM. So that is why we are taking our answer as 99203, low MDM. Final medical decision making will be low. If you see the hierarchy, this will be a moderate, and this is a straightforward, nothing but a minimal level. In middle, we have low level. It's an average. Okay, not too low, not too high. In middle, we have a low level. So it will contribute to 99203. So this is how you can utilize the other coding guideline if you get all three MDM elements are different. Okay. So for one more example, for the better understanding, we will see. A 30-year-old female reports burning during urination and frequent urination. Urine analysis performed revealing an infection. The provider diagnosed UTI, prescribes nitrofuranation RX medication, and advised increased hydration. Okay, so what is the problem here? Problem is provider diagnosed UTI, urinary tract infection, and also if you check the data point, they have performed urine analysis, and then it prescribes RX medication. Okay, so all the PDR you have to check. So options 99212, 213, 214, and 215. Okay, so considering it is an established patient, so we can see like problem is urinary tract infection, UTI, which comes in acute uncomplicated illness. Okay, so we'll see the rationale for your understanding. So here number of complexity of problem addressed is acute complicated illness, that is UTI, okay, which meets low complexity, and data reviewed and analyzed, urine analysis qualifies as a minimal data under category 1. So it is a minimal data and low complexity of problem, and risk of complication is, the risk is moderate risk because they have given the prescription drug management. So if you see all the three MDM elements are different. Okay, so again if you take the average level between these three level, we will end up getting low level. Okay, final MDM will be low MDM, and it supports level 99213. So risk is moderate, data is minimal, problem is low. So in between the average, okay, we will get low complexity. So we are considering 99213 as our final medical decision making level. Okay. So one more question. A 95-year new patient present with a fever, cough and body ache. The provider performs a detailed history physical exam, orders COVID-19 PCR test, reviews the result as positive and prescribes symptomatic treatment, which is acetaminophen. Okay, so now we will see the rationale. So problem is fever, cough, body aches. The main problem here, patient got COVID-19, COVID positive. So with COVID patient positive, patient is also having fever, body aches and cough. Okay, these are the symptoms. And if you see the patient age, which is 95. Okay, so for the patient above, like his elderly patient, so for him COVID-19 will be a big problem. Okay, considering all that problem, we have to judge like exactly what kind of problem it is. Okay, so see the rationale here. Problem addressed is acute illness with systemic symptom, because COVID-19 was there. With that, we had a few symptoms also, and considering patient age 95, we are concluding it as acute illness with systemic symptom. Okay, which can severely damage his respiratory system. So we are considering it as a acute illness with systemic symptoms. So we are getting moderate problem, and data reviewed, one test ordered and reviewed, which will be minimal. Risk OTC management low. Okay, acetaminophen will be a OTC drug, so we are taking it as OTC management, and risk will be low. Okay, so if you see, all three MDM elements are different here also. And here also we are going to take the mid one. Okay, average level. So to consider moderate, it will be the highest one. To consider minimal, it will be the lowest one. And in middle average, we will get low level. Okay, overall MDM will be low. Answers must be 99203. 99203 will be our answer. Okay, so likewise you can just note down three different elements. Say for example, you are getting problem as minimal problem, data is limited, okay, and risk is moderate. So in this case, problem is minimal, data is limited, risk is moderate, your average will be limited or low level. So you will take final MDM as low MDM. Okay, and same way, if you take problem is a minimal and data is moderate and risk is high. Okay, so in this case, to consider minimal, it will be too less. To consider risk as high, it will be too high. So in middle you have moderate risk. Okay, so you can consider moderate. So whenever you have any one element as high, okay, remember this point, whenever you have any element of high, we have to give more attention to the medical record. Okay, because generally if any one element is giving you high level, overall MDM can be high. Okay, because somewhere if they have documented patient condition is life threatening, so in that case you don't have to check the other MDM elements, because the provider is saying that a patient condition is like life threatening, so we have to go by high risk. Okay, that is a different concept, but so far I'm just trying to explain how to take the average level. Okay, so compare, when all three elements are different, take the mid one, average ENM level. Okay, so you will be getting a correct ENM code. So I think that's all guys. So please go back, and as I said, I will add those two videos in the description. If you are completely new to ENM, better first you visit those videos and then come back to this practice question. Okay, here I have not elaborated anything, so I have only focused on question and I've only applied those two MDM guidelines. Okay, so if you really want a basic, then please visit those videos. After watching those, you can come back and check this video. Okay, so yes, that's all for today, and thank you for watching. Okay, please subscribe to my channel.